I recently had a doctor's appointment and was chatting with the doctor's assistant, and she knew that I was a political reporter and asked me what was happening on the Hill, and we got one thing and another. And I mentioned how Stephen Harper has a long-term opposition to Medicare. She was totally surprised by that. She had no idea that Harper opposes Medicare. What do you think Canadians need to know before they go into another federal election? What do you think would happen if Stephen Harper got a majority government?
We would lose Medicare. There's no question about it. I mean, even the Premier of Newfoundland, who is a progressive conservative, I say progressive because Stephen Harper is not a progressive conservative, but Premier Danny Williams has said repeatedly that Medicare is not safe in the hands of Stephen Harper, even now under minority government, let alone with a majority. So if progressive conservative premiers are saying that we should be very vigilant, that we cannot trust any national program with Stephen Harper. He doesn't believe in national programs. He doesn't, it's ironically, he's really in the wrong job. He doesn't believe in the role of the government of Canada in social policy. He thinks everything is, if has any value at all, it should be left up to the hands of provinces, or in some cases, government should be out of it altogether, and just the survival of the fittest individual. So this rigid, rugged Darwinian philosophy is really at the root of his formation. And so people need to know that Medicare is not safe with Stephen Harper's government, that he is not to be trusted, and especially with a majority government, that we would see the system broken up and the end of national standards, the end of a national program.
Do you have any whistleblower sources at Health Canada who have been talking to you about program development or undevelopment or other things that they might know of that indicate the potential plans of a conservative government in waiting?
No, the whistleblowers I know have all been fired. You don't whistleblow at Health Canada and keep your job. They fired all the scientists, so that's the notion that there's easy whistleblowing going on in Health Canada. But the thing is, Health Canada is in the dark. Stephen Harper's running the files. He's appointed a caretaker minister who's not running anything. All the orders at Health Canada are coming directly from the Prime Minister's office. And right now, the message is lowball your role. And so that's why you never really hear about the health policy coming out of the Government of Canada. And they've walked away from a lot of their commitments. There was agreements from all of the First Ministers in 2004 agreement, the Health Accord, that there'd be national pharmaceutical strategy, as an example. The Stephen Harper's government has directed Health Canada to walk away from that working group.
What is the Canadian Health Coalition doing to alert Canadians to the lurking dangers of the complete destruction of Medicare as you're outlining?
Well, we've recently launched a new campaign website, which is Medicare.ca, and we're encouraging people to log on and sign our Medicare Protection Pledge. Send in your email, then you'll be part of our ongoing actions. And as part of that, we're asking people to write to their Member of Parliament, insisting that the federal Canada Health Act be enforced in order to stop extra billing, which we know is going on in several provinces. So log on to Medicare.ca and follow the links to this campaign, and get informed on what's happening and the threats, and take action. It does make a difference when you contact your federal members of parliament.
Thank you very much, Mike McBane.
Thanks a lot.